Our mission is to empower individuals and organizations by simplifying the complex process of international applications and guiding through the intricacies of global opportunities, be it education, career, advancement, or business expansion. So in basically today, we are going to talk about the NCLEX program. But before we do that, I want us to talk about our services in general that we do offer at Apply International. So we do offer NCLEX revision classes. We also offer NCLEX registrations. We also train for English proficiency exam, that's IELTS or OAT. We also do international severe alignment, visa application service, and also help with international university application. This is our contract. In case you want to talk to us, you can write down our numbers. You can just give us a call or messages on WhatsApp, and we'll be there to address your concern. Majorly, today, the webinar was organized so that we can give insights about the NCLEX. NCLEX is a registration exam for you to be a USRN. So I'm going to just talk briefly about the NCLEX registration process and what it entails. So basically at Apply International, we usually guide our clients through the application process of NCLEX. So for the NCLEX process, you need to do all these steps for you to be ready for the exam. So I'm going to take you through the steps briefly before I usher in a program admin director to talk to you about NCLEX program. The first thing you need to do is to do CS application. That is with either Joseph Shinley, that is GSA, or CGFNS. So for CGFNS, you're going to pay $485. For Joseph Shinley, you're going to pay $400. So it's you to decide which one you're going to go with, because both of them, they are evaluation bodies. Once you do that, they're going to give you forms that you're supposed to take to your nursing school and nursing council so that they can be verified and sent to them for them to issue the CS report. Once the CS report is issued, you need to register with the US Board of Nursing. We are going to guide you on the best board to apply with. Why? There's one thing we call compact states and non-compact states. We are going to advise you which one you're supposed to go with and the advantage of going with one or another. After looking at your qualifications, we advise you the best state board of nursing to go with. We're also going to give you the fingerprint cards, that is the FBI fingerprint cards that are required for fingerprinting so that you can take your fingerprint and have them sent to the organization that is doing the fingerprint for the board of nursing. Once the board has received all that is the CS report and the fingerprint results, and they have updated, you can now apply with Pearson VUE. Pearson VUE is the center that administers NCLEX exam. So once you register with them, they give you an ATT. ATT in full is authorization to test, which you use to book for the exam. Once you get the ATT now, you can book and schedule for the exam in the nearest exam center near you. So the good news is there's a center opening that was launched in Kenya. So we are waiting it to be operationalized so that now our clients, especially those from North Africa or West Africa, can now do the exam in Kenya. So for you to take you through all this, we charge a service fee of 13,000. That's the only money you pay to Apply International in regard to NCLEX registration process. But the other application fee that you're supposed to pay to these bodies, you're going to pay using your credit card. So I'm going to take you through the cost briefly. If you have a pen, maybe you can write it down. And also, if you engage us on WhatsApp, we are going to share with you the breakdown for NCLEX registrations. So for the CS report, I said if you go with CGFNS, it's $405. Joseph Shinley, it's 400. You are supposed to choose one. Then for board application, it varies the board you go with. For instance, Texas is $75. Fingerprint application, it's $38.25 if you're going to go with Texas. Pearsonview application, it's $200. NCLEX scheduling, it's $150. That is the fee that you are looking at in regards to NCLEX registration process. One thing that you need to know, NCLEX exam, you cannot just prepare for NCLEX and go and write the exam without completing the registration process. Yeah, so basically that's all I have in regards to NCLEX registration process. We are going to talk more in the Q&A session. So at this point, I want to introduce my colleague, Mr. Chacha, to take you through the NCLEX exam, tell you how it's done and what is the NCLEX exam, the number of questions to expect, how a pass or fail is determined, and the NCLEX test taking strategy. He is our program director at Apply International. And I want to just mention briefly, there's a class starting on Tuesday. So if you haven't registered after this presentation, feel free to engage us. Also remember, if you have a question, we'll be having a Q&A session at the end of his presentation. So you can feel free to ask your question. Thank you. Mr. Chacha, you can take over.
All right, thank you so much. Our registrations director, Mr. Dennis. And I want to take this opportunity to salute all our clients, our colleagues, our friends who have joined us today in this webinar. Please feel most appreciated and feel most welcome. My name is Thomas Chacha. You can call me Thomas, that's my name. I am a nurse, a registered nurse. I'm a Kenyan. And I thank God that I have been registered in the United States as a registered nurse there with the Texas Board of Nursing. I have endorsements with the Florida Board of Nursing and Arkansas Board of Nursing as well. Right, so my colleague has talked to you about the process, the registration process, and what it entails. Now, mine will be to briefly talk about the NCLEX, what it is and what it is not. All right. First of all, I want to echo what he has said, that we are having our classes, a thorough review, a very comprehensive review for NCLEX, a 4-month, a 4-month session, which we believe that if you begin the classes and you begin the registration processes at the same time. By the time your CES report is out, either by Joseph Silney or by CGFNS, because we give ourselves about 6 months. When you begin the process now, it can be out by 4 to 6 months. So by the time you are done, we shall also be done with the review, 4 months, so that you have maybe 1 month for final touch up, and then you book your exam and do your exam. This is a gateway to practice in the United States. It is a gateway to practice in Canada. It is a gateway to practice in Australia, because NCLEX applies to those 3 countries that I have mentioned. Now, this exam in Africa, so far, we only have 1 center that is operational. And this center in South Africa, in Johannesburg. That is the only center that we have in Africa currently operating. And it's a small center. In South Africa, it takes about 12 people. So in one particular shift, it takes about 12. The government of Kenya has lobbied so much to have a center here, because there is a huge potential and a huge market for the Kenyan nurses that want to export their talents to the United States. Okay, guys, there is no sound from my side. Finally, I think I also something like that. Your mic is not on. I can only see the video. So you may need to log out and then join in. Please, Dennis, I request that if you can just type that information, because if I can check on Aklil Haile, the mic is not on. What I can only see is the video icon. All right, yeah, so I was talking about these, and I hope you're able to hear. And if you can't hear, please let us know in the chat box. I'm keeping an eye in the chat box to see your comments. So anytime you're not hearing as well, please let us know. Yeah, so I was saying that we currently have only 1 center that is operationalized in South Africa, and the Kenyan one has been launched and commissioned, but I think there are still processes, but I think the process is top gear to operationalize it. We cannot tell when, we cannot promise that it is going to be tomorrow, but all indicators are that this center is to be operationalized any time from now. So that will relieve us some pressure, because it will be a huge advantage to the Africans and the surrounding continents, because that means that now if you miss a slot in Johannesburg, then you have to go all the way to India or even Philippines, right? Or even Philippines to do that exam. Okay, so that is important. That is important that you need to know that. Please register for this exam, register for this review. We have 3 services that we offer at Apply International as far as NCLEX review is concerned. One is the one that I have talked about. We have a 4-month comprehensive review, which is also accelerated review, that covers and brushes over every content that basically you learned in your college, okay, to become a nurse. That one, we will charge you Kenyan shillings 25,000. Yeah, 25,000. In terms of dollars, please, Dennis, you can convert that and give us in terms of dollars. Was it $200 or something? I hope so.
$200, sir.
200, right?
Yes.
Yes, so that one we will charge $200 if you are paying in terms of dollars, and if you're paying in terms of our Kenyan currency, is 25,000 Kenyan shillings. for the entire 4 months. So if you can even calculate that monthly, you see that it is very, very affordable. Yeah. Monthly is something like 6,000. 6,000, that's about $50. It's about $50 a month. All right. Okay. So therefore, that is what you'll be charged. So that's program one. Program two that we also have here. Individualized training. Individualized training, this is when, what about the CFA, since I'm from Cameroon? So Dennis will be addressing those questions if you can. Okay, yeah, so we're saying that we also have number two, individualized training. So in this individualized training, it's a bit costly because we will give you one tutor that will take you through the entire process at your own pace, at your own time. So you will have to pay 45,000 Kenyan shillings. So I believe that Dennis, in terms of dollars, comes to what is it, $350 or $400?
It's $300.
$300.
Yes.
All right, so that's what we call individualized, where you may not, because when we're talking about the 4-month review, there will be 3 classes in a week. We'll have a class on Tuesday, we'll have a class on Thursday, and we'll have a class on Sunday. Okay, so 3 classes a week. That is the review for 4 months, 3 classes a week. And every class is at least 2 hours. So that means that in a week, you will have a minimum, in a week, we're going to cover a minimum of 6 hours, but that can go 6 hours to about 10 hours in a week, right? With so many questions, of course, so many questions, so many resources, and the serious engagement, and we engage all our clients. We must make sure that they are occupied all through assignments here and there, just to be sure that we are moving on the same direction. Right, so that is for the review. And for the individualized one, you want to be taught, you want to be taken through as an individual for the entire content. That will cost you $300 USD, okay? Or if it is in Kenyan currency, it will cost you 45,000 Kenyan shillings. And then the third program that we have is what we call an expedited review. So this is for people that have already gone through the content, and now they're just coming for us to check and to assess them and to help them in their weak areas, maybe for a month or so. Yeah, maybe for a month or so. So that one you'll need to part with 15,000 Kenyan shillings. Yeah, 15,000 Kenyan shillings, because you also have to, you'll be assigned to a tutor who will be checking on you daily, doing assessment, to see which are your weak areas, where you need to improve, and such kind of things. All right. So that is what we call follow-up and review. So just basically for follow-ups to see how you're doing, how far you've covered the content, because you're saying that you've gone through the content maybe in Sounders or whichever book you're using, and you have an ATT you want to test, and we want to see whether you are really ready for this exam. Also tell you what is the probability of you passing, because we can tell that from the assessment that we do. So those are the 3 services that we have as far as NCLEX is concerned. So number 1, again, we're saying the 4-month thorough review, okay, 25,000 Kenyan shillings or $200 US. Okay, the second one is individualized training for an individual. That one will take for as long as you want, but cannot go more than 6 months. Okay, you have to work with the tutor individually. That one will cost you $300 US or 45,000 Kenyan shillings. And the third one is the review and assessment and follow-up for those that have already gone through the content and they just want us to do the assessment and see whether they are good enough to face that exam or which areas they need to improve. That one will charge you 15,000 Kenyan shillings, which I think is about $100 US. if I'm not wrong. Dennis, please let me know. Is it so?
$150.
It's $150. Yes, $150. Right, so basically, that is all the services that we have, ladies and gentlemen. Now, let me briefly talk about what is NCLEX, okay? So I'm sure at this level, now that you have an interest to join the NCLEX class, probably you know what NCLEX is and why it is an important exam. It basically stands for National Council Licensure Examination. Remember, we have NCLEX-RN, registered nurse, and NCLEX-PN, okay, practical nurse. So you need to know which one do you want. Do you want a registered nurse or a practical nurse? So that even when you are booking your exam, then you book the right exam, okay? So that is what it means, the National Council Licensure Examination for registered nurses, okay? So this examination is administered by the National Council of State Boards of Nursing, right? So what does that mean? Whatever that means is that, you know, United States is a big country. So as such, it has 50 states. So every state has a board of nursing. Yeah, every state has a board of nursing. Please, when you join, just mute. We'll give you time to ask your question. Yeah, so every state has a board of nursing. So these boards of nursing from the 50 states, they come together to form a national council of state boards. So they are the ones that sit, generate exams, and put those exams in the Q bank, question bank. So they have so many questions, millions and millions, because NCLEX did not begin yesterday. It has been there for the longest, right? So they have millions and millions of questions because they continue updating their Q bank. So that is why you cannot say that, please go and do that exam and come and tell me which questions you are tested so that I can go and revise. No, there's no way. The likelihood of repeating even a single question, it is almost zero. They can repeat a concept, but not the question exactly, right? So you need to get that right, because all these 50 state boards of nursing, they come together to form this council, right? So the main reason why you have to undergo this exam is because anytime we are having, you know, regulations, the regulations are there to protect the public from unsafe and ineffective nursing care. So that's why we say that NCLEX examination, by the way, it's not a test of your intelligence. It is just a test to see whether you are a safe nurse and a nurse that can prevent complications, right? It is all about safety. It is all about safety. It is a safety exam. That's what they are testing. That's what they are testing for, right? To see whether you are a safe nurse and whether you can be able to prevent complications from occurring. So it is not testing your pathophysiology, your anatomy and physiology. No, no, no. We'll tell you what it is, right? Okay, what is the purpose of this? This basically, as I have said, is to determine if you are a safe nurse and if you can practice. Now, NCLEX exam, by the way, is a very easy exam. I can tell you for sure. It's a very easy exam, and that is why people fail. You know, people fail very easy things. People don't fail it because it's so difficult. I will tell you why people fail. It's because it is easy. And it is easy because it is not testing your intelligence. It is just testing your critical thinking, your way of analyzing. It is all about safety and prioritization, because when you prioritize, you're able to know which client will I see first and which one is in immediate danger, which one needs to be rescued first, and so on. So that critical thinking is very key. And even when we are teaching you, when we are taking you through the review, we are not teaching you what is anatomy. We are not teaching you, by the way, we are just giving you strategies and tips and how to answer questions. That is what we are giving you. And trust me, by the way, you cannot sit alone and say that, fine, I think I can read. I'm a nurse, I'm qualified, I'm registered, I can read for myself and pass that exam. Trust me, the probability of you passing that exam is almost zero, okay? Because you need to be guided properly. you need to be guided properly. That guidance is key, and that is what we are doing here. We are actually guiding you. We're only offering guidance because you're already a nurse. We are not teaching you to be a nurse. You're already a nurse. We're only telling you what NCLEX is looking for, how their questions are asked, and how they should be answered. Okay. So this question is a test of minimum competency. You don't need to have a specialty, maybe critical care nursing or whatever. It's just a test of minimum competency, right? So you don't need any specialty. Just a diploma or a degree, you are good to go. Very many people have been asking that, okay, what is needed? Just if you're registered a minimum of a diploma or a degree in your country, then you are good to go. You are good to go. So this is not a test of achievement or intelligence. No, no. Critical thinking, safety, and prioritization. You will not be tested on all the content that you are taught in high school. I mean, you have only a minimum of 85 questions and a maximum of 150 questions. How do you expect 150 questions to be asked? The biomedicals that you are taught in college, the parasitology, you know what, the psychology, I mean, you'll not be tested. We will tell you what you're going to be tested, what you're going to be tested on. Now, this is important. You can take a screenshot of this. This is important so that you know how NCLEX is set. NCLEX is set, or NCLEX focuses on these 4 client needs, on these 4 thematic areas. Yeah, the first one, we call it safe and effective care environment. So you can see the compilation. So this one alone will take about 25% to 37% of the entire questions that you will meet in that test, whether you're doing 85 or whether you're doing at least 25% to 37% will be from safe and effective care environment. So you can see the number one thing actually is safety. That is one thing, and you see it carries a lot actually. The second one will be health promotion and maintenance. This is where we majorly have maternity and the newborn nursing. Yeah, health promotion and maintenance, HPM. So that one carries 6 to 12%. So that's why very many people will tell you that there was only one maternity question. There was only one midwifery question. Sometimes it's not very huge on NCLEX. Okay. Psychosocial integrity, this is the psychiatry bit. It's things to do with psychiatry, addiction, substance use, therapeutic communication. This is in psychosocial integrity. You can also see it takes about 6% to 12% of all the questions that you're going to meet. Now, when we come to physiological integrity, this is basically the medical surgical nursing that you did plus pharmacology. So that's why it is big, because medical surgical for both for an adult client and for a pediatric client. So this is what we're going to cover into details. Okay, all these areas will be comprehensively covered in our review, and we've broken them down in ways that you can understand step by step, moving from one concept to another, that you are able to link and understand and actually know what you can expect, Yeah, so this is also another way to present that distribution, the content distribution in a graph like that. Right now, how is NCLEX marked? I know I've been meeting this question severally. Okay? That what is the pass mark? Is it 60? Is it 50? Is it what? Eh? Is it what? Now, I want to tell you that NCLEX is not based on the pass mark, that maybe you must have 70%, 80% or not. This is a computer adaptive test. It's called a CAT. A CAT means that it is a computerized test. So it is the computer that is going to grade you. And what is the computer looking at? The computer is not looking at how many questions you are getting. The computer is interested with what we call the confidence interval. Yeah. And once you hit 95% of the confidence interval, where the computer is satisfied that you are a safe nurse because you've gotten many of the questions correct, then the computer will shut at the minimum. So when you begin your exam, what happens is that you can have a minimum of 85 questions. So if you are able to get these questions well and the computer is satisfied, by the time you reach 85 questions, if you have convinced the computer that your confidence level is more than 95%, you are a safe nurse more than 95%. It's not 100% because you can't get all the questions right. That's what we're saying about 95% confidence level. Then the computer is going to shut at 85 questions. And when it shuts there, it means two things. Either you've passed or you failed, all right? Because if you don't meet this confidence level, then you are going to fail. So this graph here shows exactly what happens. You see the green one, the green line that lies horizontally is the passing grade. So it means that every question that you get right, you will be above the passing grade. Yeah, the graph will be drawn above the passing grade. Okay, so you are not supposed to come below this passing grade. Even if you come below it even once, trust me, you have failed. At the end of the exam, 85 questions or so, you shall have failed. Even if you've gone below this line even once, okay? So why are you seeing this amplitude moving up and down, moving up and down? So what happens is this: once you get the first question will be a medium question. It's not difficult, it is not very easy. So when you get it right, they give you a more difficult question. So the more questions you get, the more difficult questions you are getting, all right? So when you fail, then they give you a lesser, an easy question. When you fail, again, they give you an easy. So the moment you fail, you are coming down, you are approaching the passing grade. So you fail, they give you an easy one. You fail, you go down deeper. You fail, you go down. So the moment you touch and go down the passing grade line, then you have failed. So that is how it is marked, actually. It's not all about that, what is the percentage that you've gotten right and wrong. No, okay? That is how it is marked. So by the time you're reaching the minimum questions, it is either you've passed or you've not passed. Okay. So what happens that after 85 questions, you're still seeing the questions coming? Whatever that means is that still the computer has not, is struggling. Still the computer is struggling. The computer is still struggling to understand you. So that's why it is continuing to give you more questions to try to understand you better. So that's why you see 86 question, 87 question, 88. Okay. So the computer has not, whether you are a safe nurse or not, so it is still struggling to understand you. So the moment it understands you, the computer will shut there. Now, another question that you'll ask me: what happens if the computer fails to understand you until you do the entire 150 questions and the computer was not able? So this is now where the board will sit down and analyze your result and give you. So that's why immediately you are done with the exam, you can't get your results immediately, because they have to analyze because of such cases that you've done all the 150 questions. It means that the computer was not able to gauge you, to fully categorize you. So you confused the computer all through. I'm using the word confused. You confused the computer all through until 150. And then, so do what? They will go and analyze and see how you are doing and then make a determination and give you a result. Okay, that is scenario number 2. Scenario number 3 is that you are too slow because that exam, you have a maximum of 150 questions and a maximum of 6 hours. So that 6 hours, the moment the exam starts, your time counts. You are allowed to take as many breaks as you want. By the way, nobody limits you. You can even be answering one question and then take a break 5 minutes. Come answer another one, take a break 5 minutes. There's nobody who is going to limit you. But you have to know that every time you get out of exam, when you come in, they have to do you scanning, checks, and everything. So that is time wasted. Okay. So maybe you are too slow that the time cut you short. When the time cut you short before meeting the minimum questions, automatically you failed. When the time cuts you short, you had already met the minimum questions 85, but the computer was confused. It was still generating questions. You had not reached 150 questions. Then they will also analyze, because that is what we are calling, that's what we are calling in this, it's called run out of time. Yeah, the computer did not score you because you ran out of time. So run out of time, yeah, you've met the minimum questions, but still more questions were being generated. And therefore, the computer could not understand you. So they will still make a determination. So that's how the examination is marked. And we'll be discussing these into more details when we begin our sessions, all right? Yes, so you only need to register and begin. We are beginning on Tuesday, the 2nd. So this is what happens. When you get a question, they give you a more difficult question. You get it right, they give you another difficult question. You get it right, so you can see if you keep on getting it right, you will always be above the passing grade. You always be operating above the passing grade. The moment you fail, they will give you now an easy one. When you fail again, an easy one, and the graph is dropping. When they give you an easy one, you pass, it again begins to peak. So that is how this computer test is designed, all right? So that is what NCLEX is all about and how it is marked. Yeah. And I want to tell you that you need guidance and proper guidance. Even if you are not going to register with Apply International, guys, this process is quite expensive. You may not want to waste your money just to try your luck. No, I want you to know that once you begin the process, you are sure that yes, I'm investing this and I'm doing it because I'm sure that I'm going to make it. Okay, rather than just throwing in your money and you just sit there to go and try your luck. It's not all about luck. This exam is real. This exam, you must be tested when you have some content, right? So you can't just say that, fine, let me just sit in my house and prepare and read for myself. It's not like IELTS where you can read on your own and pass sometimes. This one, you must be guided. So having said that, I want to pause it there and we open a question and answer session briefly. And I think that will, because this webinar was designed to go for 1 hour, I think we have about 10 minutes to the end. Otherwise, thank you for listening to me. And we have it now, a question and answer. You can raise your hand or you can throw your question in the chat box here, or you can simply unmute here. Yeah, just raise your hand. Yes, I can see better. Your hand is up. Please, Dennis, be writing these questions down. We'll address them. Please, better unmute yourself and ask your question or your concern, please.
Okay, thank you so much for the opportunity. This is better. I would like to find out, after the NCLEX examination, will I still need to have IELTS before I can go ahead to be employed, or it is only the NCLEX that I need?
Right.
And also, I want to find out, I did a degree in public health nursing for 2 years. I want to find out whether I am qualified for the process.
All right. Thank you, Betha, for that question. Let me try to answer the first question. The first question is, once you've done, you don't need IELTS to register for NCLEX. You can register for NCLEX and do and pass NCLEX. But will you need IELTS at some point? Yes, you will not immigrate unless you have IELTS, because the IELTS result is what will be used for what we are calling visa screening. Yeah, visa screening is that they want to see that you are meeting all the competencies, you have all the qualifications, you have the English proficiency, you have the examination pass. So you need that IELTS during the visa screening. So what do we advise at Apply? Immediately you pass NCLEX, immediately, like you did NCLEX today and tomorrow you have your result, please enroll and begin English immediately so that it does not delay your process, because you can't apply for visa screening if you don't have the IELTS. It's a must. Now, about the second question, you've asked that you did public health nursing. So the question is, what are you? Are you a registered nurse or not? If you are a registered nurse, fine, you are eligible for this process. So it's as simple as that. Are you a nurse or not? All right, Beth, I hope I've answered you.
Okay, so how our educational level is, I was a diploma midwife and I went ahead to do the degree in public health nursing. So in this case, I don't know how I will be placed. We have general nurses and we have midwives. So I was a midwife with diploma and I went ahead to do degree in public health nursing.
So right now you are a midwifery nurse, or
I am a registered public health nurse.
Fine, you qualify for that registration. Please, Dennis, you'll confirm that, but you qualify for that because you'll need verification during application in CGFNS. You'll need verification of your documents for both the diploma, that's the midwife, and the public health nurse degree. So you'll need that to support, and they will generate a report that yes, you are in the same level of a registered nurse in the US. Right, Betha?
Okay, sir, thank you so much.
Right, you are welcome. There's a question here. Please, what is the correct band score for IELTS? Dennis, do you want to take that, or you can go ahead and answer it?
Go ahead. Hello.
All right, so let me answer this question here. Yes. Hi, Dennis, are you there?
Yes, I'm there.
Yes, please. I want you to answer this question by Sergey. Is it Sergey? Sergey? I don't know how to pronounce that name.
Yeah, I can.
Yes, it's asking.
Yeah, it's okay. In regards to the IELTS band score requirement for US, you need an overall IELTS band score of 6.5 in 7 in speaking. So you need an overall of 6.5, but you need to have 7 in speaking. Also, there's a client that asked about the program that she had done. So on that, you advise you share your documents with that your nursing school. We'll evaluate and let you know if you qualify for NCLEX. But basically, after listening to your case, you qualify for NCLEX because you did an additional of nursing program after doing midwifery. Thank you.
Right, thank you so much. Yeah, so the question on IELTS, I want to tell you that it is only in the US where the IELTS requirements are the lowest. Other countries, Australia, UK, the requirements, the band requirements are actually high. It's only in US where you can find that the bands, because for the US, they're only looking at the overall band score where you need a 6.5 and above. In other countries, it's a 7.0 and above. And when we come to these key areas, they only interested with speaking. So you can have any other score in those three, but in speaking, just have 7.7 and above, and an overall a 6.5 and above, and you qualify for. So the US is the easiest to get. The US is the easiest to get in terms of IELTS, right? So I hope we've answered that question well. Okay. Do we have another question, please? You can put up your hand and we give you a chance to ask your question. We have about 2 minutes to go. Maybe a point of clarification, anything, point that is not clear. Apart from that, you can always reach us on our official. Yes, Eunice of Fori, your hand is up, please.
Hello, please. Hello.
Yes, good. Hi.
Yeah. Please, the IELTS, is it which model do you want? Is it the academic or the general?
That's a good question. You will need the academic IELTS, not general. Academic IELTS, this is what is for people that are going to pursue further studies and for people that are going to work. The general one is not for us. We are required to do the academic IELTS.
Oh, okay. Thank you.
Right, welcome. There is two people that have raised their hands. Okay, Eric Basara. I think Eunice, you can now put your hand down unless you still have a question. Eric, please. Eric, your hand is up. Is it a question? A clarification about the exam schedule and the exam place. Okay, about scheduling the exam, Haile, we will schedule the exam with you. We will schedule the exam with you. You will tell us where you want. We will only tell you the centers that are there. Like in Africa, we say that we only have South Africa as of now, as of today, South Africa. So we'll tell you in South Africa, these are the slots that are there. This month is full, or these are the dates that are there. Then you say that, okay, fine, I want to do this exam on such and such a date. And in South Africa, we don't have such an opening. So we say, where else can we go? Can we try in India? So we look at India. So we will book that exam. We schedule that exam together with you and the place for your own convenience. So we will avail to you all the centers. Right. Please, Dennis, answer this. Does Texas accept OET for visa screening?
Hello. Unfortunately, no, you will need IELTS for visa screening. Most states does not accept OET. But one thing you need to know, Texas does not do visa screening.
Yes.
The visa screening is done by CGFNS or GSA, that is Josephins and Shinley. Texas, what it does, it issues you with the license. So for the visa screen, which is needed for immigration, it's done with CGFNS or GSA. In case you have more inquiries on this, you can contact us. I've shared our contact. We'll be discussing more about the same. So in case you need any clarification regarding visa screening process, you can contact us or give us a call on the shared number. We'll be sharing more.
Right. Beth is asking, will apply international help us get a job after the whole process? Definitely, yes. We will link you up with, we will help you in the process of getting a job. We will align your CV. We will tell you how to apply and link you with what we call the direct hire. Yeah, direct hire, where you have to negotiate your own salary while you're still in your country. Yes, so we will help you. we've been doing this for quite some time and our clients are happy. Do you mean during CGFNS I must write OET? Are we saying that many states in US, CGFNS is the one that does what? Is the one that does the visa screening. But visa screening, many states do not, they don't prefer the OET to do the visa screening. So it means that you might be forced, depending on specific states, in as much as it is CGFNS that does the visa screening, you may be forced to do IELTS because IELTS is widely accepted. So we will guide you depending on your preference, where you want to work, what is your intention, and so on and so forth, whether you take OET or you take IELTS. But to be on the safe side, why don't you just do IELTS, because IELTS is accepted in all the 50 states and other countries around the world without these limitations and these,
Hello, maybe Mr. Chacha, I can clarify on this because this is a question that I've been seeing. So for you to register with a board of nursing, there are some boards that need the English proficiency test. Don't confuse that with visa screening. There are some boards for them to allow you to do NCLEX. One of the requirements is for a foreign educated nurse, you need to prove that you need to have a proof that you know English. That is by presenting English proficiency test. So there are some states that accept OET, IELTS, TOEFL. That is for NCLEX registrations. It's not a mandatory. It depends with which states of which board of nursing you are going with. As we have discussed, we are going to advise you because it's not a must for you to do English proficiency test so that you can write NCLEX. After passing NCLEX, you are supposed to do visa screening, which is mostly handled by your employer or the direct hiring agency. For that one, it's a must for you to do a visa screening, to have a visa screen certificate. And we have advised you that the only bodies that does that is CGFNS or TSA. One of the requirements is IELTS. That is English proficiency test. You also can use OET. You can also use TOEFL. But that is for visa screening process. So I want you to note that. Then I have seen a question on, just a minute. There's a question that was asked on let me retrieve it. I think Mr. Chacha, you can go ahead as I look for that question. Hello, I can see Eric Baraza, your hand is raised. Go ahead.
Sorry for the mix-up. My question is about NCLEX preparation. May not be ready to do to be ready to join the class in April. When is the next class?
We have an intake monthly. So we are going to be communicating on our next intake for NCLEX preparation. That will be on May, early May. So we'll be communicating on our platform, also on our social media platform. So our NCLEX training is done monthly. So if you miss to join the class that is starting on this Tuesday, you can make preparation, you join the next intake. That will be on May.
Thank you very much.
Welcome.
kwani si nitasikia hata kama imeshikana hivi.
Okay. Any other question? Yeah, there's this person that is Beta. He asked that he started the process in our home country, and can I continue in a different country in case I travel out of my country? Yes, you can. It's not a must for you to be in our home country to do the NCLEX process. You can continue the process even if you're not in our home country. There's a question on, I think kindly can mute. Okay. There's one this question on you mean I must write NCLEX first before writing IELTS? On this, I can say it's not a must for you to write IELTS for you to do NCLEX. IELTS is not a requirement for NCLEX. But even if you have done it, there is no harm. You will use it during the visa screening process. But you don't need it. What you are trying to emphasize is, even if you have not done IELTS, you can register for NCLEX. So I'm going to share our contact. In case you have any question, you can reach out to us, and we will surely address it. So that's our social contact. You can write it down. In case you have any question, feel free to engage us, and we'll be happy to assist you. So there's a question that has been asked if we have people find a direct hiring job. Yes, we do that. Once our clients pass NCLEX, we'll link them with more than 7 direct hiring agents who it's you to decide on which one to go with. So we also do coaching for interview, because that interview is the one that determines the kind of going to get from your employer. I can see Akili has raised his hand. Go ahead.
Good evening, everyone.
Good evening.
Akhlil, I have a couple of questions. One
Yes,
is about the the one is about the exam. Does it include practical exam like demonstration, or like it's theoretical?
Okay, I think maybe you did miss the presentation by our program director.
Yeah.
I'll be sharing the recording on the group or on the WhatsApp page, so you're going to follow it up. But to briefly answer it, the NCLEX exam is a computer-based exam that you're supposed to do in a sitting of 5 hours.
Okay,
Yeah,
that's
it's a computer-based exam with multiple choices.
Okay.
Yes. So I'm going to
This
share the
one was
recording.
not.
You are going to follow it along.
Okay, that's good. My second question, you will process for all international nurses, like I'm not from Kenya, just I'm from another country, but I'm a registered nurse.
Yes, we do serve clients globally. We have clients from Ghana, we have clients from Nigeria, we have clients from India, from South Africa. You can see even our pages, we have clients all over Africa, even outside of Africa. As what we do, we help clients who wants to do the self-sponsored program for NCLEX and enjoy the best rates.
Okay, that's good. Thanks.
So I beg to stop there. If you have any question, feel free to reach out to us on our social media platform. One thing I want to emphasize enough, for those who have enrolled in our April intake that is starting on Tuesday, we are going to share the timetable and the materials with you. So keep checking your emails latest tomorrow. The classes are beginning on Tuesday. And those who are also interested in joining the program, feel free to reach out to us so that you can secure a slot. Have a wonderful evening. In case there's a question that has not been addressed, feel free to reach out to us on our social media platform. Thank you and have a wonderful evening. Enjoy your Easter.
Okay, thank you very much.